the vaccines are expected to be approved for children ages 2 to 11. What current information can you share with us about the safety of these vaccines for young children?
For young children, the studies are ongoing, and so far information suggests that they're good. My kids are 14 and my son just turned 17. They both are now fully vaccinated. And so I think that my belief about it begins at home. As you can imagine, they're the two most precious individuals to me on this earth, and I certainly would not subject them to anything that I thought would even partially harm them or had any risk. And so at least in that 12 to 16 group that was most recently approved, the vaccines proved to be very effective, probably even more so than in the adult population, and with very minimal side effects. So both of my kids, as a result, have been vaccinated. The early information on very young children appears to be trending in the same direction. And so when we get the full results, hopefully, again, it will prove to be similar to what we've seen in adults in 12 to 16, and hopefully kids ages 2 to 11 would be eligible for the vaccine before the end of this year.
So there are multiple clinical trials that are going on in this younger age group. Most of the vaccine producers who've already been approved for adult vaccination are now doing the trials in smaller and younger individuals. Again, wearing my pediatrician hat, I think it's really important for people to say, well, we already, some people say, we already know it works in 12 to 15-year-olds and in adults. Why can't we just give it to the younger kids? But, kids are not small adults, right? So we know that physiologically they're different. And so we really do have to take the time to make sure that those trials are done properly amongst that age group, and that they go through the same rigorous process of review, just as we've done with the teenage, adolescent, and the adult vaccines. So I know that Pfizer is planning on submitting their EUA for this younger age group in September. I imagine that the other companies will follow suit soon thereafter. And, we will see, but it could be sooner. It just depends. Sometimes these trials, they do interim analysis to see if they're seeing any signals that the vaccines work, and at that point, they can actually stop the trials a little bit early and review the data. And so it could be that by fall, maybe we have the EUA approval for the younger age group. Again, thinking about it in the context of Sidwell Friends community, this would be a huge win for us, right? We want to make sure that everyone in our community is able to avail themselves of the vaccines, including that younger age group. So again, this is just another step to help us get back to the community that we once knew, and being able to be back in the school and everyone being together.
I think it's harder to speculate there, but all the early data indicates that these vaccines are safe in that community. And certainly I expect, perhaps before school starts, for the FDA to go ahead and make their judgment about that public. To some extent, age is really a proxy for height and weight in kids. And so, it's highly likely to be approved. And we shouldn't speculate on that when it's approved. I hope everyone in the Sidwell community gets it. One of my kids is under the age of 12. And so we're waiting for that approval. And as soon as it is approved, we will be first in line, or we'll stand in whatever line we can find to go ahead and get it. We're very fortunate in the United States. I get to work on this issue on a global basis. And there are, billions of people living in countries that have had 1 or 2 or 3% vaccination rates, and they're suffering very, very high death rates, very high mortality. Their economies are still locked down. They're still wearing masks and not able to be productive in society, and suffering a great deal because of it. And we're fortunate. We have we have broad accessibility to vaccines. And one of the folks I was speaking to, who is in charge of a major public health system in a lower income country, pointed out that it's hard for folks to sit back and watch some Americans be sometimes, legitimately hesitant to receive their vaccinations when there's so many people standing in line unable to yet get them. So, I think the right thing to do, and I applaud the school for doing it, is to just make sure that everyone who qualifies for and for whom the FDA has said this is a safe and efficacious product goes ahead and gets vaccinated. It keeps your kids, your family, and our community safe. And we all know how important it is to have our community back in action, especially in the fall.